Ulnar nerve is one of the terminal branches of medial cord of brachial plexus. It receives fibers from C8 and T1, and sometimes C7. Ulnar nerve leaves the axilla medial to the axillary artery to enter the arm and course on the medial side of the arm, and enters the forearm, posterior, to the medial epicondyle in the ulnar groove. In the forearm, ulnar nerve runs distally on the ulnar side of the forearm, between flexor carpi ulnaris and flexor digitorum profundus muscles. Ulnar nerve runs in cubital tunnel formed by the tendinous arch, connecting humeral and ulnar attachment of flexor carpi ulnaris muscle. Ulnar nerve gives muscular branches to the flexor carpi ulnaris, and medial half of flexor digitorum profundus muscles and articular branches to the elbow joint in the proximal forearm. It further descends in the forearm and gives off two branches in the middle of forearm, which are palmar and dorsal cutaneous branches. Palmar cutaneous branch supplies skin on the medial side of the palm, while dorsal cutaneous branch supplies the medial half of the dorsum of the hand, the fifth finger, and the medial half of the fourth finger. Ulnar nerve passes superficial to the flexor retinaculum and enters the hand between pisiform and hook of hamate, otherwise called ulnar canal or Guyon tunnel, and gives its two terminal branches, superficial and deep branches. Superficial branch gives cutaneous sensation to the anterior surfaces of the medial 1.5 digits. The deep branch innervates the following muscles: the hypothenar muscles, the medial 2 lumbricals, the adductor pollicis, the deep head of the flexor pollicis brevis, and all the interossei muscles. The deep branch also gives articular branch to the wrist, intercarpal, carpometacarpal, and intermetacarpal joints. Injury to the ulnar nerve most commonly occurs where it passes posterior to the medial epicondyle during fractured medial epicondyle. Compression of ulnar nerve in the elbow results in cubital tunnel syndrome. Ulnar nerve can also be compressed as it passes between pisiform and hook of hamate, known as ulnar canal syndrome, especially in long-distance bicycle ridders. This results in numbness and tingling of the medial part of the palm and the medial 1.5 fingers. If the compression at the elbow is severe compression, it may result in pain that radiate to the forearm and fingers. Motor loss from the distal lesion leads to loss of function of intrinsic muscles of fourth and fifth fingers, resulting in loss of flexion at the metacarpophalangeal joint and extension at the interphalangeal joint of fourth and fifth fingers. This manifests clinically as claw hand from hyperextension at the metacarpophalangeal joint, due to unopposed action of long finger extensor muscles and flexion at the interphalangeal joint. If this video is helpful, consider subscribing or clicking the like button.